Want to give people a chance to get in and get logged in. I see some familiar faces. Enid, Shelby.
I don't have these on.
Great, we'll give it about another minute and then we're going to get started. Welcome to the Your Life Matters Seville COVID vaccine virtual town meeting. That's a mouthful. All right, and so to respect people's time, we're going to go ahead and get started. Graham, if you don't mind, you can go ahead and start the recording. So I'm Dr. Janita Richardson. You'll see my face in just a minute. We want to welcome you to the Your Life Matters Seville COVID vaccine virtual town hall meeting. We wanted to host this meeting supported by the sponsors that are noted here on this slide. It's a collaborative of organizations that have gotten together to make sure that the Black and Brown communities are being vaccinated equitably and that the information that's being shared with you meets the needs of the community. So this is hosted by the Your Life Matters Seville Collaborative, which is also the organizations below are also part of that collaborative for this specific COVID vaccine effort, which are the African American Pastors Council of Charlottesville and vicinity, Move to Health Equity, Centera, Star Hill Health Center, as well as the University of Virginia Department of Public Health Sciences. So there I am, and so welcome. The reason that we wanted to host this town hall meeting is a couple of things. I'm sure most of you are aware that the J&J vaccine was paused and then has come back online, which raises a lot of community questions about this vaccine initiative as a whole and that particular treatment as specifically. So we wanted to address that. And so we have physicians that are available to answer questions and are going to talk to us. We also wanted to provide community members feedback on the efforts that have already taken place to provide vaccines to members of our community and what community folks are saying about that experience, how they've been feeling, what concerns have arisen. And also we want to use this forum as an opportunity to get feedback about how we should move forward. COVID's going to be with us for a while. And so we want to get feedback from the community so that as a collaborative, when we think about how we want to be supportive, we want to use the priorities that you've articulated to guide our efforts. So one of the things that the next thing I'm going to do is I'm going to introduce our speakers. And then I'm going to do what's called launching a poll. Some of you might be familiar with that and some of you not, but I'll walk you through all of that. So to begin, we'll have Jacqueline Martin, who many of you know, who's the Director of Community Outreach for Centera Martha Jefferson. We'll have Dr. Michael Williams, who's an Associate Professor of Surgery and Public Policy at the University of Virginia School of Medicine and the Batten School. We'll have, when he comes out of the ICU, Tyson Bell, who is an Assistant Professor of Medicine in Infectious Diseases and International Health and Critical Care at UVA. We have with us Shelby Edwards, who's the Executive Director of FAR, the Public Housing Association of Residents. We have with us Gertie Sanders, who is a community activist and liaison. She's worked closely with Jackie Martin and talking to lots of folks in the community, both Charlottesville and Albemarle, about their concerns about the vaccine and getting people scheduled. And last but certainly not least, we have Reverend Dr. Alvin Edwards, who's the pastor of Mount Zion First African Baptist Church, who incidentally also is a former mayor and chair of the school board of Charlottesville. So he brings a wealth of knowledge to us. So thank you, all of you panelists, for agreeing to spend some time with us today.
Thank you.
So before we start with our actual presentations, two things. Just please remember to remain muted unless you're speaking, and we'll have opportunities for you to ask questions. And I'm about to launch a poll. So the way this works is I'll push a button, and in the middle of your screen, some questions will pop up, and then you just click the answers that are most appropriate for you. And then at the bottom, you'll say, done, send, completed, and it'll come back magically and it will tabulate. This poll is anonymous, so there is no way to connect your answers to any individual person that submitted the answers. So please be brutally honest. What we want to do is to use this information to help us craft events that are meaningful to you as a community. So, and we also have technical support for you. So if you're having problems with the poll, just put a note in the chat. And I have 3 people who I should mention who are here to help with all things technical. So we have Graham, who is in the Department of Public Health Sciences, and we have Malik, who is graduating this semester with a master's in public health. And then we also have Diana, who works with Jackie Martin and also with the Move to Health. And so let's give it a try. You should see now that there's a poll in the middle of your screen. Jackie, can you see it? Okay.
Janita, the submit button is not submitting.
Graham, can you check into that for me?
I think you have to go all the way to the bottom. I think there's 7 total questions.
Yeah, there's 7 questions.
I didn't know if you scroll down or scroll that way. I don't think it'll let you answer until you've answered all of them, or it won't let you submit.
Got it. Thank you.
I think he's right. We're starting to see some responses now.
Yeah, here they come. Grim, I didn't think about it. We could pause it while people are doing this.
Okay, I'm down.
Why people receive their vaccine at the Your Life Matters events, and there's a lot of other, the poll doesn't allow us to put in multiple, to leave it open and open-ended, but if you wouldn't mind, if there were any of you that put other here, you can please note that in the chat about reasons why the Your Life Matter events at Carver worked for you. And then it seems that everybody's heard about J&J, of course, and that, that, and understandably has raised concerns about whether or not you would consider getting the J&J. So I'm going to stop sharing this now. Thank you for doing that. Okay. And so now we're going to get on with it. Thank you for working with us with that. So we're going to start with Jackie Martin sharing what is Your Life Matters CVille, because some of you may not be familiar with that. So Jackie, can you just fill us in on what is Your Life Matters CVille? How'd that come to be?
Sure. So Your Life Matters CVille is part of an effort to help people, specifically Black people, connect to services. And so on the Facebook page, you'll find all kinds of resources, both physical health and mental health resources. We have food access programs, educational opportunities, job opportunities. It's just a way of helping us to connect to culturally sensitive opportunities that are out there in our community. And when the vaccines rolled out and Black and brown people were just so obviously missing from the vaccine lines, Your Life Matters CVille really came to represent what our collaborative led by the African American Pastors Council was all about. And it was about Our Lives Matter. And we came together to make sure that not only did Black and brown people have an opportunity to get a vaccine, but that it was done in a way that both honored and respected us. So our Facebook page continues to grow, and we invite you to check it out. And it's also part of a bigger vision of, really connecting services for people that might happen in maybe one physical location at one point down the line. But it's really come to represent what this vaccine effort has been about.
Thank you. I should also add, for those that weren't aware, that that Jackie's work actually predates the vaccine, because there are a number of us that are actually part of this collaborative that started working back when we were just testing for COVID, when COVID first became identified as a pandemic, and we came together to try to get testing out into the Black community and hosted events at Carver for that too. So it was a natural continuation of the work that you were already doing to sort of birth the Your Life Matters collaborative and then focus on the vaccine. So thank you for that. So we're going to move on to our clinical expert, so Dr. Michael Williams. And I don't know if Dr. Bell has been able to join us yet, but Graham, if you wouldn't mind highlighting Dr. Williams, and if you see Dr. Bell, let him in. Michael, can you just share with us, like, what is it? Let's start with, what does it mean for a person to have COVID in the short term and the long term? I know people have heard this a lot, but can you give us the abbreviated version?
Sure. So the most common symptoms that patients present with when they're infected with COVID is pneumonia. And that's the thing people have talked about, is a COVID pneumonia. It's often in both lungs, which is not usually the case with pneumonias in general. But there are a whole host, and at this point, there's almost nothing that, other than cancer, that people have not linked to COVID infection. But one of the major things that we know has become a very common theme is blood clotting that's abnormal. So in terms of increased risk of blood clots in a variety of places, not just the lung, but risk of stroke and heart attack is also significantly higher if people have COVID infections, which again, we think is because people are in general more likely to clot off things that normally wouldn't as part of a COVID infection, an active COVID infection in particular. And then there's sort of the asymptomatic version of it, which is probably less asymptomatic other than less symptomatic. People who have felt kind of cruddy for a while or had some aches and pains that came and went, fatigue that was in excess of the usual pandemic fatigue that we're all experiencing. A lot of that's also probably COVID infection at a relatively low level in terms of the amount of virus that a person is experiencing. And then sort of and that's the very compressed version of what COVID infection does to you. The other important thing is that, COVID infection that's serious still has a very high mortality rate. And thankfully, the most effective thing we've gotten so far to prevent a person who has a COVID infection that requires hospitalization and that is serious, and that is sort of Dr. Bell, Dr. Williams level in the ICU, serious, still has about a 40% chance of dying from that process, which is much, much higher than pretty much any other condition that we have that's acute in Western medicine. And the longer term question, we don't know yet. The COVID pandemic has not been going on long enough anywhere that we really know the long-term effects. I will say that there's a growing literature, there's a growing body of science out there that suggests that the effects of COVID infection are going to be durable for even those who are mildly infected. And so people who are kind of having the blahs after COVID infection are reporting that they still have those blahs months. We're over a year into the pandemic, and we're beginning to get that data as well. But there's a lot of folks who have this residual kind of hangover effect from COVID as up to a year and counting. And so we don't know what that other end of that bookend looks like as of now, which makes avoiding getting infected that much more important.
Okay, so we know it's really highly contagious. So as a Black physician, why do you think it's important for people to get vaccinated?
Well, there's a whole host of reasons why specifically Black folks need to be getting vaccinated as soon as possible. Not least of which is, unfortunately, I think most of us know that Black folks tend, and I always want to begin these conversations with the following disclaimer: there's nothing wrong with us, right? This is not a failing of being a Black person, and that's something that was, the last administration tried to claim that it was because we were quote unquote vulnerable. Ain't nothing about Black folks that is vulnerable. It's because of the years and years of discrimination that we have all faced. It's actually immune suppressive and a whole other bunch of things that we are all exposed to disproportionately compared to our numbers. That leads us to be much more likely to become seriously ill from COVID. And because more of us live in close proximity to our additional generations of our families and what are referred to as multi-generational home settings and congregate care, so housing complexes, there are more of us who tend to live in that environment than white folks who tend to live more often in single family homes. And this is just raw numbers wise. So our exposure risk is higher. Black folks and brown folks, as I think most of us also know, work in what are referred to for a long time as essential jobs, right? And so those of us who work in the food service industry, those of us who work in healthcare in a variety of settings, those of us who work in transportation, those of us who work in service industries like grocery stores, the post office, where you can't do it remotely. Even if you wanted to, the job happens in an in-person environment. And I think one of the more telling examples is those who work in the meat packing industry and the meat processing industry, where you can't process chicken and fish remotely. So we were exposed disproportionately and continuously during every phase of the pandemic and remain so. And so as a result, Black and brown folks are just at a higher risk of exposure to COVID from their normal environment where they have to be to earn a living and to sustain themselves and to keep employment and frankly to keep eating, to have enough money to buy food for themselves and their families. The other big thing is that Black and brown folks are also disproportionately, so more of us than should be if all things were equal, overweight, obese, and have type 2 diabetes. And all those things also are risk factors for not only being exposed and becoming infected by COVID-19, but also having it seriously infect us and having us hospitalized as a result. So there's a whole list of things that are generationally determined and things that we have no immediate control. You know, none of us going to stop being exposed to those risk factors overnight. And that renders us more susceptible to infection with COVID. And then if you happen to be a person who has high blood pressure, a lot of us do, including myself, overweight or type 2 diabetes or type 1 diabetes even, or other immune suppressing conditions, we're just at increased risk. So Black and brown folks have died at a higher rate than white folks have. Our infection rates have been at a higher rate. So we have the most to lose, frankly, by not becoming vaccinated as quickly and as early as possible and as broadly as possible, because the ability for this virus to jump from person to person to person is actually much higher than most of the viruses any of us have ever heard. So early on in the pandemic, there was this perception promulgated that it's no worse than the flu. That's just not true. It's much worse than the flu, and it's much easier to transmit from person to person than the flu or really anything else you can think of. So there's a whole litany of reasons why Black and brown folks need to be first in line and to be offered vaccination, but that's just a short, compressed list.
So let's flip this to the positive side. Now we've got vaccines that are available to us.
Mm-hmm.
So I'm hesitant, but if I get the vaccine, how does my life look now? Like, so I understand that there's different masking requirements now and all sorts of things they're saying that I can do once I'm fully vaccinated, which we know is a certain number of days after your second dose, right? But can you talk to us about like, what's life like after a vaccine?
Yeah, and full disclosure, I was just about first in line, and Doctors Hilton and Bell were, I think, 1 and 2 here at UVA, and I was the very next day. I was, I think, the 44th person at UVA to get vaccine. So I ran to get my vaccine. So I'm weeks and weeks and months from becoming as immune as one can be from this thing. I have been really happy to hear the CDC change their guidance yesterday. It was yesterday about maskless moving about when you're outside, and so the idea that you can move about parking lots, for example, without a mask on and say hello to people and see their smiling face is one thing. Sporting events, as I was saying, Janita earlier, my oldest is playing soccer right now for Monticello over at Albemarle. My wife, who is 10 days out from her second dose, can sit there with her mask off in the stands and cheer on our daughter, and she can hear her. I think we very soon will see that there will be enough post 2 weeks from second dose folks in the country, because we're on a pretty good pace right now to get the vast majority of people at least 1 dose of J&J or 2 doses of one of the other 2 vaccines. That sporting events in public, so professional sporting events, football games, basketball games, particularly things that are outdoors, will be, you can do that without a mask. So you could go and walk in without a mask and sit there without a mask and cheer without a mask and then go home. And as the numbers continue to climb here domestically, the other, I think, very important thing that people should really take to heart is that the main upside, in my mind, the main 2 upsides of vaccination is your risk of infecting someone in your family who is not vaccinated goes down dramatically. And that's because your chance of having enough virus in your own circulation to be a shedder of virus to others goes down dramatically. And then personally, your chance of having serious COVID infection is incredibly small, and chances of having a serious COVID infection and dying is even smaller. And so protecting your immediate family with whom you live, even potentially your coworkers with whom you work side by side on a daily basis. And then, yourself, looking out for yourself is the other main reason. But for me, it's making sure that our community is able to protect itself from this virus that has so far taken such a huge toll on us.
Great. So the people had gotten used to, Moderna and Pfizer and scheduling 2 vaccines, and then everybody was really excited about J&J. Well, not everybody, but there was excitement around there being a 1 dose. Then it got paused, and then they came back on. Can you, in like 5 minutes, I know there's a lot more to it, but can you explain, like, why would they stop it if they thought it was, like, why did they let it out in the first place, right? If they had to be paused, and then why did they start it up again?
So a disclaimer, I'm going to give you my professional opinion on having reviewed this science. They should not have paused it because the risk of getting hit by lightning every year is 2 times higher than the risk of 1 in 500,000 individuals will get struck by lightning every year. So your personal risk of getting hit by lightning is at least 2 times higher than getting this serious clotting problem from the J&J vaccine. And they've identified something like 16 cases globally in the neighborhood now of about 9.5 million doses. So the math plays out extraordinarily heavily in favor of taking the J&J if it's offered to you, recognizing that your risk of having a bleeding complication from an aspirin is much higher, frankly, than having a clotting complication from the J&J.
So can I just pause you a second? So 15 or 16 people had the adverse thrombosis. I don't even know if I'm using the right words. And there were like 9 million people who had that same vaccine.
Yep.
Okay. So, and what you're saying is, we'd have more of a risk just taking aspirin every day of having a bad health outcome or getting hit by lightning than if we took the J&J. Is that the math?
Absolutely.
Okay. I just wanted to just sort of, okay.
Yeah. And I'll go even further. My daughter turns 16 next month, and I signed her up today so that on her birthday, when she's 16, we're going straight to Big Shots to get her vaccine. And whatever vaccine they have is the one she's going to take. And if it's J&J, I will say thank you very much. Have her stick her arm out, and we'll go home in 10 minutes, and that'll be that.
Happy birthday to her.
Yes, indeed.
Okay, which brings me right to the next question, which, so J&J can be administered to people 16 and older. So what advice would you give parents as they're thinking about vaccinating their children?
Yeah. So I think it's the science about kids was sort of the second wave of the science that was done. It was everybody studied the drug initially in older folks. I'm getting close enough that's getting to be a little personal statement there, but the target was roughly 60 and older folks for a lot of the clinical trials. But then as that data matured and showed that in the real world that people were able to take the vaccine, the clinical trial data was unfolded for, down to 18 for Moderna and down to 16 for Pfizer. And that's shown that it's incredibly safe and effective. And frankly, as far as a 16-year-old's body and physiology is concerned, compared to a 9-year-old, in terms of its immune response, it is not a whole lot different. So I would expect that the clinical trials, which are ongoing now in kids as young as 6, for both Moderna and Pfizer, will show the same results of 94-ish% efficacy in preventing mortality or death and serious COVID infection. And then J&J, because of the press that's happened globally, they're going to have to walk a finer line. And the current warning from the CDC is to just advise, particularly women of childbearing years, particularly those who have been recently pregnant, that there have been the 12 reports, because not all of these reports were in women, but most of them by far were, of the serious, I mean, very serious, don't get me wrong, it's a very serious complication that is associated with, but based on the science, you can't possibly say it was caused by, right? That's like saying your death of heart attack was caused by getting hit by a car. It was the car, not the heart attack, right? And so I think for parents, and as I told you, if J&J is offered for my 16-year-old and my 14-year-old when his time comes, they'll be first in line if I can get them to be first in line, absolutely. And Janita knows me enough to know that I love my children like I love breathing. So I would never put them at risk that I don't think is appropriate. I think the first vaccine that your age eligible child can get their hands on and their arm attached to, you should take absolutely. The risk of COVID infection among young people has gone up, and those numbers are what's driving the current numbers around the country, including here locally. So there have been, more kids have died of COVID infection and its complications than adults have had the serious clotting problem from J&J. Right, and more kids have been hospitalized with serious ICU level illness and ventilators and talk of lung transplants than have had the clotting problem from J&J. And there have not been as many infections as kids early in their pandemic. That is shifting now. That demographic is shifting earlier or younger and younger. And so kids seem to be the current passers of most of the vaccine between each other. And so, my oldest goes to Monticello, as I alluded to earlier. Monticello sent us probably an email a week of, there's been 3 kids who've tested positive, and those kids who were exposed to them at school have been identified. But that's probably been a weekly occurrence, maybe every other week, where some number of children have tested positive in public schools here in the county, at least. So the way to skip that next step in having our kids get infected is to get people vaccinated as quickly as possible.
Great. So, this whole decision about whether or not to get the vaccine is really a risk assessment, a personal risk assessment, right?
Yes.
Deciding if you are more afraid of the consequences of COVID to you and to your family versus are you more afraid of the consequences of the vaccine for you and your family? It's really a decision that individuals have to make. So if participants don't remember anything else that you have to say until we get to the Q&A section at the end, what would you want them to come away with as your sort of most important takeaways?
Yeah, so I think the 2 most important things are that vaccination is incredibly safe compared to any other life risk you might experience. As I mentioned, lightning strike is more common than a real serious problem from any one of the COVID vaccines that are available to us currently. And that COVID infection is actually no joke, right? And so there's been this sort of this rolling belief that, well, I'm tough and I've been through worse and I get the flu every year and I've survived that. And that is just not normal thinking. Okay, that is not a reality-based thinking. COVID infection is serious. It may have lifelong effects we just don't know. And so if you can avoid it, and I'm telling you that by getting vaccinated, both shots of the Pfizer, Moderna, or the one of J&J, within a couple of weeks of your last dose of whichever vaccine you get, your chances of dying of COVID, and more, I think as importantly, potentially giving somebody else COVID, drop to negligible, to just, a rounding error, as we say in statistics. And so I would urge everyone, if you take only one thing home, it's that COVID infection is very, very serious. It is no joke. People on this call, we are ground zero for this thing. Don't let anybody tell you anything otherwise. And that vaccines are absolutely safe and the way to go.
All right. Well, thank you so much. And thanks for hanging around for our Q&A at the end. We really appreciate you. So for participants, you should know that if you have questions for Dr. Williams or any of the panelists, just drop them in the chat. We're going to be answering questions in the last 20 minutes or so of our time together. And so we're going to turn now to sort of a community voice. Thank you, Dr. Williams. And we're going to hear from Shelby Edwards and Gertie Sanders to talk about, hi, thanks for coming. So we're waiting for both of you to get, there you go. So we'll get spotlighted for both of you at the same time, and that'll be great. So I guess, Gertie, why don't we start with you? And so can you share, like, what are some of the concerns that you heard in the community about getting vaccinated, either from people who didn't want to, like hesitancy, or actually getting their hands on one, or their
Okay.
arm, or one in their arm?
Yeah. So I think that I would just share the conversations, and I would break them up into two groups. So there was the first group, and I'm going to I'll call group number one, who basically had a distrust of the medical community in general, just in general. These were people that did not get flu shots. They barely took medication. So they were just skeptical of the current system in which we operate in. So, and some of it was based on historical information, but some of it was based on personal experience that, sort of supported their distrust. However, there was another group, still in group number one, that said the vaccine was just created too quickly for them. They just did not believe that the efficacy, first of all, they questioned the efficacy, even with data on their side, but they just felt that it was too quick for them. So they pulled back, and they decided that they were going to wait for a while. And then there was a situation when people started to get the vaccine, and people started talking about symptoms, and we know that there are normal symptoms that people will get. So then they started to think that, will I get sick? And I think Dr. Williams talked about that a little bit, in terms of, there are expected symptoms that you will get if you get the vaccination, as your body tries to ward off this, form of antibodies. And then there was group number two. And that group had no qualms about getting the vaccine. They just wanted to know, where can I get it and when? So and I thought that was very important, because the narrative in the community was just about to begin saying that Black people do not want the vaccine. So when I contacted people, when I was talking to people, and it was overwhelmingly, I want the vaccine, I just don't know where to get it. So earlier in the initiative, when vaccines were not plentiful, that was a problem. That was absolutely a problem. And at that time, my opinion, there wasn't a clear roadmap of how to access the vaccine. And the registration process was cumbersome at best.
Right.
So you had a whole group of people that were saying, I want the vaccine, but I just don't know how to access it. And I think that I know that Your Life Matter was able to address those concerns with effective advertising, right? Providing great information and creating a seamless process from start to finish. So I think that really did support any kind of concerns they were having, any barriers, and I'm going to call them barriers, because when we first started this process, there were absolute barriers that existed. So I think that we were able to remove the barriers and get people vaccinated.
Great. So Shelby, I'm going to punt the same question to you. So you have a large service area of communities that you serve. What were you hearing in your communities about what they were thinking about the vaccine?
First of all, I want to say yes, yes, and yes to everything that Gertie said, because I think a lot of that translated to the communities that we serve as well. I think a layer that I'll add on to that is that one of the sites that we serve has folks who are elderly and disabled. And so what I saw an overwhelming amount of was misinformation. And legitimate questions like, okay, well, will it have something in there that will hurt me from the government? And I think that what needed to be done, and what was eventually acknowledged, was a very transparent conversation about no, this is what we know about it. And I think that when we have in the life world of the internet, where like everything is changing on a daily basis, if someone's not comfortable using a computer, or if they don't have access to the internet, then by the time they read the flyer that's sitting next to their elevator, it could be 2-3 weeks old or have incorrect information. And so I think even when we look at the J&J vaccine, I think that it's important that we like let folks know what's going on, because if they get a vaccine, they hear about it late, but they don't know that by the time Charlottesville got the vaccine, for example, that they would have already known that something would have been wrong. I think we've, as a community, have tried to do our best to stay ahead of the 8 ball and like let folks know the information that really they should have access to. So I think we've done a good job as a community trying to bridge that gap.
Yeah.
Janita, can I just add something to what Shelby said? I think that one of the things that I found, like when I'm in the community, I don't think that I know everything. I don't know everything. However, what I do know is I know where the information lies. So if I don't know, and I think this builds trust within the community, I will get that information and bring it back to you. I will bring it back to you, and I will. And those of you who know me, I will ask 100 questions until I get the answer that I need to get it back to the person so that they can understand what it is that they need to do, what the next step is, or to alleviate any kind of anxiety they might be having around any problems that they may have around accessing a vaccine. So.
Yeah, that's a good segue to where I was actually going. You were in my head. Because the skepticism and the distrust of the medical and research enterprise in our community is a rational response.
Yes.
There's a long history of us being used as lab rats, and so skepticism was natural. And each of you in your capacities have worked really hard to create health education materials that address the questions that people have in the way that you've talked about, Gertie. And then Shelby, you had actual information that you were distributing to residents to answer their questions. So can you talk, each of you, doesn't matter which one first, about how do you think those, what kind of mechanisms did you use to share information with the communities? And then how do you think that worked? Like, was that helpful?
Well, I guess I can speak to FAR. I think FAR was able to help in a few different ways. We have a fabulous board, shout out to my board members, that are members of the community. And so at board meetings, for example, we carved out time to have Q&As about COVID so we can set this straight, knowing that if our board members who were leaders of the communities had the information in the board packets that they were handed and inside their heads, when they were asked questions by their neighbors and friends, they could answer that. Or a few weeks down the line, I know that there were clinics at Crescent Halls and at West Haven. They were able to have folks in the communities chatting, saying, no, we can trust these people. And I also want to shout out Sharon and April over at the West Haven Nursing Clinic, who have been building these relationships for years and were able to connect it. But also shout out to the board members as well who were able to do it. I know there was one resident who will remain unnamed, but when asked about taking the vaccine, she said, I don't really know about it, but I do know my friend said it was safe, so I should probably do that. And I thought that was so sweet. And she was able to do it despite her fear of needles. And so I think that community engagement, like getting really at the root of what the community loves and believes and being truthful, is a huge portion of it. So that was a little bit about my experience.
Yeah. Well, and then you modeled, right? So
I did. I will also add that. So I received the vaccine at one of the West Haven clinics. And so I was able to walk through exactly what the residents had. I made an appointment. I showed up on time. Each and every time that I went, I don't know if this was intentional or not, all of the people who were giving shots were all Black, which is super dope. And I was able to sit down, make sure that I was taken care of, went about my business. And I was really surprised at how easy it was. Like I thought it was going to be this whole stressful event where I wouldn't know, it'd be dark rooms, spiders, whatever, but it was really nicely done. And I was really happy to do it. And I'm fully vaccinated and I'm a happy camper.
Right. Great. And then you also just, your people are not good at tooting their own horn. So you also work to create information that people could reference. So I just want to pull that out too, because in the poll that we just did, it was a lot of people were interested in and thought that getting information in advance about the process and the transparency of the process was critical in their decision about whether or not to get vaccinated and where. And so I just want to give a shout out to the information that you had available to residents that answered a lot of the questions that people had. So Gertie, could you speak to how information got out about the events that you were involved in? And
Yeah. So there was lots of email and lots of, absolutely involved in churches and sororities. Initially, Jackie and I co-authored the process for getting out the information because we had a very quick turnaround time when we wanted to do the initial event. So lots of buzzing around the churches and calling them up, rallying the pastors and getting them involved to call their members. And I mean, they were all in. And it just went really nice. And then once people have your phone number, this is kind of interesting. They will call you back and ask you another question. And that is and I find that very rewarding when people trust you enough to ask you, can you get someone else in on this vaccination process? I also found that those people who were, as I called them on the phone, because there was an outreach for calling on the phone, that was how it was got. And there was this document out there that I used a lot, and that was, it gave a parallel explanation of all the 3 vaccinations. So that was very good for people who really didn't know how it worked. So that document, and I must say that was my go-to when somebody had a little bit of concern and didn't know whether they should have gotten the Pfizer, Moderna, or the J&J. I can say, I can send you that. I can send you that, and then you can make a decision, and I'll get back with you. So it was that. So a lot of just conversation. And I'm gonna tell you what I learned, Janita, too, when I was talking to people. I learned how to listen. I learned how to listen better because, we want you to take the vaccine. That was why we wanted to rally you to taking the vaccine, but I didn't want to disempower you. I thought that my role was to try to give you as much information as possible to make your own decision. So I think and I do believe that it was effective. I absolutely believe. And I keep going back to the barriers that existed when we started this. And I think the other thing that I remembered saying a lot is, I can help you with that. I can help you with that, with confidence, because sometimes I didn't know how I was going to help them with that, but I believed that I believed that I could help them. And I don't recall a time that I didn't help someone to remove a barrier. So that was just that. I enjoyed it, the process immensely. It was so rewarding.
thank you so much. So, I mean, what I'm hearing is that it takes a lot. So first of all, there were existing relationships in the community. It was about listening to the concerns of people in a respectful manner, addressing those concerns, meeting people where they are, and then making the process manageable for them so that it was as easy as possible. Nobody likes to get a needle in the arm, but it's making it as seamless a process as possible, right? So I don't know if you have the approximate numbers, Gertie, do you know about how many? I think Jackie would know.
Yeah, actually, this process began in February. I think we've had 5 clinics already, right? Jackie, and you can nod in affirmation. 5 clinics already. We had, the first dose for Pfizer and Moderna, first and second dose of Pfizer and Moderna, and then we had the J&J. And I'm happy to report that we vaccinated 1,500 people.
That's amazing.
Isn't that amazing?
That's amazing.
15, and then, and I think that for me, because to target Black and brown people and to have Black and brown people at the door saying, I'm so happy that you're here, and treating everybody with dignity and respect and just, just wanting to help. It was just amazing. Amazing.
That's great.
That's all I can say. It was amazing.
Yeah,
Mm.
I heard reports. So people were calling me that had come, and it was like, it was kind of like a party. I mean, I was getting
You are so right. And when I was thinking about it, I said it was like family. It was people were coming in and they knew each other and they had little conversations on the side. It really was. It really was like a big old family reunion coming together.
That was great. So Shelby, there were vaccine events at Crescent Halls and at the West Haven Clinic. I don't know if you know the rough.
Yeah, I don't know the numbers off the top of my head, but I do know, and I love, Gertie, that we keep talking about barriers, is that one of the barriers that we were able to remove was the geographical barrier of going to UVA, because for a lot of people, and maybe I'll speak for myself personally, going to a hospital is not a fun time. I do not associate it with good things. But so for me personally, be able to go to a clinic where it maybe I know people and I did is completely different. And when we look at residents, it's an easier sell to walk down the street to get a vaccine than it is to call a taxi to be able to have to go find childcare, whatever. But instead you can have such and such and such and such playing outside. Like, so I think that what I really loved was the physically going to the different neighborhoods and being able to do that, especially for Crescent Halls, where a lot of the folks are immunocompromised anyway.
Yeah.
Right. So I'm gonna ask you each at the end of your little segment here, the same question that I asked Michael, which is what's the key takeaway that you have for people that are joining us about the vaccine or anything else that you want people to keep in their mind as they depart us?
Well, certainly I have to echo what Dr. Williams has said, that please get the vaccine. The benefit certainly outweighs the risk, not just for yourself, but for your family and everybody that you love, and those that you don't love too, those that you don't love. I just cannot see a reason not to get the vaccine. I just can't. And I know that there may be those still that are thinking about getting it, but consider those you love. Consider those that you love.
Thank you. Shelby?
I'm actually going to take a different spin on this. Well, if you don't remember anything from this conversation, I want you to think about your gifts, your privilege, your talents, and think about how you can use that in service to improve other people's lives. That could mean, you have a gift of wanting to get your vaccine, so you go do it, so you help your neighbor. It could be you have privilege and you want to help somebody who is disenfranchised to be able to go further in life. I would encourage everybody to think about that, think about your gifts, and make sure you put it to work, and then you do the work, whatever that means for you.
We got to be here to do the work, right? So.
Yeah.
All right. Well, I want to thank both of you very much. I really appreciate it. We're going to switch now to Jackie Martin and Pastor Edwards as just a lead in to their segment. Everybody probably already knows. If they don't, they should. How pivotal Jackie's work and the African American Pastors Council of Charlottesville and vicinity have been in getting vaccines specifically designated for the Black and Brown community and implementing forums where this happens. This did not, the ability to have the events at Carver and the upcoming one, which I'm going to show a slide for in a moment, next week, are largely due to these two people and the organizations that they represent. So I want to thank you both for that. So can you share, let's start with you, Pastor Edwards. So how and why did you get involved in getting information and vaccines available for Black and Brown people? We'll just start there.
First of all, I'm thankful for Jackie and you two, Dr. Richardson, for all the hard work you do and have done on this. But I got involved because I've always been a person interested in health and well-being. My own personal health challenges. 2 years ago, I had cirrhosis of the liver. And it was from the doctors and nurses would laugh at me and say, Pastor, how much do you drink? And I told them about 5 glasses of wine a year. They say, you don't drink. And they would laugh, when I would tell them that because, I don't. But I was concerned about not only my health, but the health of my people of Mount Zion First African Baptist Church, and as well as in the community. And so my interest in health, my oldest brother's a doctor. And of course, I'm always a needle in the haystack, and I'm always trying to rub him the wrong way about things and challenge him, medically about stuff and why he did it this way or that way. But anyway, so, that kind of whetted my appetite. But also the other thing that did is the health of our members in our church. I always want the best for them. I want to make sure they have good information. I want them, and I've tried to lead by example. I would not want any of them to catch COVID from me or anyone in my family or anyone else in the church. And so I wanted to be vaccinated. I needed to be vaccinated. I have high blood pressure. I'm predisposed to diabetes. And plus I have asthma, and it's seasonal, even though it's in the springtime. So I need to make sure that I take care of me, because if I don't take care of me, I can't help take care of other people. And so much so, that our Black nurses meet here, and I do give, our nurses can make me sit down and be still and go home and rest and stuff. I do listen to it when they tell me that because of their field, because I also believe that the doctor is God's servant. And so I honor that and I respect them. I do what my doctors ask me to do and do all the follow-ups. Should never forget late Ida Lewis, former member of our church. She's deceased now. But Ida had made arrangements for me to go see one of the doctors up at UVA. And so she had told him, she said, well, he ain't gonna tell you the truth. So when I met with the doctor, I told him, I said, you asked me, I'm gonna tell you, because I said, you can go ask my PCP. He will tell you. If you ask me a question, I'm gonna tell you the truth. I'm not gonna lie about it. Why would I, and so I wanna take care of me. I wanna be the best I can be. I can't do it if I don't respect doctors and nurses and the health community. And, usually during this month, we would have some kind of health forum. Right. Before COVID hit, we was in the process of planning, and I'm gonna shut up after this. Before COVID hit, we was planning this event called Know Your Numbers, which Miss Jackie Martin was leading. And that was just for all men. And that is, know what your blood pressure is, A1C, all those things. We wanted people to know. And we were going to send buses out to pick up indigent men and bring them here and get them tested and have some fun and what have you. So it's always been an issue. It still is an issue. And I want to make sure I do all I can as God's servant to make sure that people are aware and have access to. And so on behalf of our President Lyndon Bates II, and with Jackie and you, Dr. Richardson, and I've enjoyed working with you all. You all know more than we know, so we just try to open some doors that we can.
Well, teamwork makes the dream work, right?
Amen. Amen.
Everyone has a skill set and a heart for the work, right? We all care about the community, and that's what we have in common, and we bring our different skills to the table.
Amen.
So I'm going to turn over to Jackie. So, this is in the line of your work, but this is also the work of your heart. So can you talk to the members here of the town hall and a little bit about how you got involved and why you cared about getting vaccines out into the Black and Brown community?
So I just feel so grateful and fortunate that I'm in a position that allows me to try to help people. And I'm also part of a great team with Satur Dillard, Diana Webb, and Sierra Wynn. And this is what we do. We respond to community needs. And so when COVID hit, we were right there with cleaning supplies and face masks and hand sanitizers early on. And distributing educational materials, because all of us on our team just really have hearts for this work. And we help to coordinate COVID testing events and listen to the community. And it was April Oliver who said, who recommended that we do resource fairs as part of our testing events. And so what we noticed as part of those events is that although all of our information had focusing on communities of color, that was not who was lining up first for our events. And so when the vaccines rolled out, we wanted to come up with a way that really was able to bring in the communities of color that we were focusing on. So we went to the churches. It was a perfect partnership with the churches and other community organizations where they were actually handing information. And I think in a lot of ways, healthcare has failed communities of color. And in one big way is that we don't respect that people receive information in different ways. So to have the complicated method that the vaccines rolled out for signing up just didn't work for a lot of communities of color. So what we were very deliberate about was offering people different ways. They didn't have to get on a computer to sign up. They could fill out a paper copy to sign up for one of our vaccine events. And it was really beautiful the way that effort grew. It was a community-led effort. So that's why, I love being a part of this effort, and I just feel so blessed to have an opportunity to try to help people.
Well, thank you. What I'm going to do now is for a second, I'm going to show our participants that there is a vaccine fair. There's going to be another vaccine event next week. And so hopefully you're seeing this now. The same URL or near the same URL that you used to join this meeting, you can look at here on this slide to see if you can't sign up versus the Google Doc, or you can call the number there, 434-984-5655. You can stop by the Star Hill Health Clinic and pick up a paper form for you or for somebody that you love to sign up for this event that's going to happen on May 6th, which is next week, from 4 to 8 at Mount Zion First African Baptist Church. So that way we can get as many people vaccinated as possible. This is a Pfizer vaccine event. So that'll be a 2 vaccine appointment, right? You'll come for the first one and then you'll come for the second, as we're all aware of. But we'll post this information, if it's not already on the Your Life Matters website, it will be there shortly. I think it's probably already there.
It is.
If you want to sign up for that event. So we thank you for that. I see that Dr. Bell joined us. So Thank you, Tyson. You're just in time for Q&A.
That's
Appreciate
perfect.
it. So thank you. So I think now's the time we're going to open it up for questions. If anybody who's participating has a question, you can either raise your hand or you can put the question in the chat box, and we will do our best to answer the questions that you have of us. So we'll give that a, okay, so so Reverend Brown Grooms has her hand raised. Brenda Brown Grooms.
Hello, thank you for this vital information. I may have missed it earlier, but I have great concern about the Johnson & Johnson vaccine. I don't trust it at all. Why should I?
So either Dr. Bell or Dr. Williams. Yeah, Dr. Williams did talk about it earlier, but you want to go for it again, Dr. Williams? So it's worth repeating.
Sure. And I understand your concern, Reverend. And I will say that the risks of the Johnson & Johnson vaccine causing the thing that led to the pause, that serious blood clotting event, are incredibly small, and the risks of getting COVID are much higher, and the risks of getting COVID at a serious level requiring hospitalization are much higher. And then I will say that the risk of having, particularly the lifetime risk of having a serious complication from almost any medication you've ever heard of is much higher, including aspirin. And so the unfortunate, what I will say was an overabundance of caution. I would say too much caution was applied to the J&J by the FDA and secondarily the CDC. The data is overwhelming, and I think we're in the neighborhood of something like 19 cases worldwide of this serious clotting event that's been documented, and that's for a drug that's having incredible scrutiny worldwide, looking for this particular thing. And the pause was really about making sure that the FDA was comfortable that they had identified all these cases globally. Over about a 9 million dose spread across the globe. So I think that I understand that the confusion and concern that was raised by the pause is unfortunate. But I will say that, if you just look at the odds, if you were a gambling person, and I'm not, but if you're a gambling person, I would take any bet offered to me that it was 1 out of every 1 million to 1.5 million times I would get it. I would take those odds every time, particularly since, as I said, there are so many more things in life that are much higher risk. I think that the odds of an African-American person getting and having a stroke is higher, frankly, just in general, forget COVID, than this particular risk from the J&J. So there's other reasons that are more technical. And I'm happy to get more technical if that would be helpful. But I think just in general, if you're looking at just the numbers game aspect of it, there's no question in my mind, and I think that's the prevailing view, that there is certainly risk, but there is risk in everything, and that the risks of this are so incredibly small compared to literally any other medication we take over a long period of time, and they're finite. Within about 2 weeks of the J&J, and the outside data is 30 days, there's no evidence at all that there's any risk of increased thrombosis, and even less risk of the very serious increased thrombosis that happened and that caused the pause.
So you're comfortable with that vaccine being offered primarily to poor Black and brown people? Because I can see that happening.
I am, and I will tell you why. The value of the one-shot approach, the one-shot methodology, and the one-shot biology, frankly, that the J&J offers, particularly for those who are poor and or living outside of a stable housing situation. The value of having only to get to a vaccine one time and not twice seriously increases the risk or the benefit for me, for folks. And there is abundant data in folks of color across income spectrum, across living situations, across health spectrum, that overwhelmingly support the fact that the J&J is incredibly safe and incredibly effective. And frankly, if Moderna and Pfizer could come up with a one-shot shot, they would have. And they're scrambling now to see if they can find a one pill vaccine. That's Pfizer is sort of in the process of seeing if they can develop a pill. But anything that has the safety profile that the J&J does, or for Pfizer or Moderna, and it's a one-shot thing, that's going to be the best bet for everybody. But particularly for those who don't have paid time off from work to take a day to go to a vaccine clinic or go to a primary care site or go to a drugstore or something like that. That's a tough sell for folks who have to work to eat. And so I'm actually very, very comfortable with it. And I think it's part of why it was so important to those of us who've been doing this work, and Dr. Bell can certainly also chime in, that whatever the company was, that the one shot aspect of it was a centerpiece of it, was that it really did help level a lot of playing fields when it comes to us accessing any vaccine.
Yeah, if I
Thank
can
you.
jump in on this, and I'm just joining, so I apologize. I had some situation going on in the COVID ICU, and I'm just out now. But the way I give advice, you are my family, and I give the same advice that I would give to my own family members. And personally, if the Johnson & Johnson vaccine were offered to my family, I'd say take it. Basically because, like Dr. Williams said, that risk of the blood clots, though it's important to know about, very, very low. So if you are worried about walking outside on a cloudy day, that's about that level of risk. Your risk of getting hit by lightning is about twice the risk of having this sort of outcome from the Johnson & Johnson vaccine. Whereas the risk of dying from COVID-19 is much higher. So if my mom, my dad, my wife were getting J&J, I'd say a prayer and just thank God for having access and getting them protected from COVID-19.
Thank you.
Yes,
Any
ma'am.
other questions?
There was a question that was messaged. Is there anything that people can do to, if they are scheduled for the J&J, is there anything that they should, like, what are the warning signs that they should look out for? They're like, what are those types of things that they should make sure that they're looking out for in case of those things, or anything they can do to prevent it?
Okay, well, I'll take this. So this advice goes in general for anything that you receive, any vaccine or medicine. But if you notice that you just feel like you know your body and your things aren't going well, and this is after the first 1 or 2 days after getting that vaccine, that's something to get checked out. To be specific about this rare issue of blood clots, they were typically formed around the blood vessels that drain your brain. There were some others that had locations in around the abdominal area where your stomach is. And some had them in the leg where you usually see blood clots. So the guidance given by the CDC is to, within that first 3-week period of getting the vaccine, look out for things like severe headache, severe shortness of breath, severe belly pain, or severe leg pain or swelling. These are those symptoms to look out for. Luckily, it's still rare. I'll keep emphasizing that. But it's important to know to be on the lookout for those sorts of rare complications. So if you notice that, call your provider, get checked out, and potentially get treatment.
And I'll add, if I could, that in terms of before the vaccine, get some rest and hydrate. But that's again true of any vaccine, certainly, and any one of the 3 vaccines that are available in this country. Just, if you're so fortunate to be able to take the day off after, because in most folks, the symptoms that they're going to have that are going to be the worst are in that 24, 48-hour period after, particularly in most cases, the second dose of one of the other 2. But the day after effect is legit. People will feel kind of wiped out on occasion. I was fortunate enough not to, but a lot of folks do report that, and that can linger for a little while. But in terms of beforehand, if you can, get plenty of rest the night before, have your, a good healthy meal the night before, get plenty of rest and hydrate with water. And that's the most you can do, or should frankly try to do it. You're not going to be able to prevent your way out of the the normal side effects of any of the vaccines that you've heard about for months now. And I wouldn't waste energy and time and anxiety levels to try to prevent something that you can't prevent.
Thank you. So do we have any other questions that are in the chat, or anybody want to raise their hand? I see that Mr. Winston is with us, who represents the NAACP, so welcome. He's been a partner for a long time as well. Any other questions?
I don't have a question, Jackie, but Janita, but I'd like to just give a shout out to Greg. And I thought I saw, I didn't see him, maybe I did.
Yeah, he's there, but
okay.
he's there.
All right. To thank him for truly tireless efforts, and the email you sent me about my cameo spot on Oprah's network was entirely because of the tireless efforts of Mr. Winston and the local chapter of the NAACP. So I want to thank him. I want to thank Lorenzo Dickerson, who took all his time to film those. And please don't embarrass me. I didn't have any editorial input because I couldn't make myself any prettier than I was or can be. But I'm hoping the message is getting out to folks. But if it is, it's because of Mr. Winston and his colleagues at the NAACP. So I just want to shout out and give some props.
So it's a common question that I hear. Which one should I get, right? So you hear that Pfizer's the 2-shot, but you hear that there are a lot less side effects with that one. The Moderna, you hear more about side effects with the 2nd shot. Then we have the J&J, which is the 1-shot. How does a person decide which one they want, if they even get a choice, right? Because some people don't get a choice. So how do people make that decision?
Well, the first thing I would say is if you do have choice, then I think as far as how well the vaccines work, I think they're all fine when it comes to what we really care about, keeping out of the hospital from getting COVID-19 and potentially dying from COVID-19. I know those efficacy numbers, or kind of what the numbers that get talked about the most, are very different between Johnson & Johnson and the other two, but they were done at different times of the year with variants with the Johnson & Johnson, and they were not circulating with Pfizer or Moderna. So I would say if there's one available and that's the one to take. If you do have the option, I think it really depends on your ability to either take 2 shots or the accessibility, or if you do have a preference for one reason. But I wouldn't let that get in the way of getting access to the one that's available the first time. So I know there have been a lot of people who say, I really just want, 1 shot and done. Personally, I took Pfizer because that's the one that was available to me, but I'm afraid of needles. So, that's what I'm going to disclose to you all. I'm a critical care doctor. I use a lot of needles, but I'm afraid of them. So if I had had the option to do a 1-shot thing, I would have taken that. But because Pfizer was what was available, that's the one I took. But it's, it's really individual preference and, what you can do. But I wouldn't let that get in the way. If there was one that was available first, that's the one I would take, the best one.
Okay, thanks. I know these are heavy on you clinicians, but I think that these are the kinds of questions that people have. We're hearing a lot about the variants, right? I don't know, 5, 6, are we up to 7 now? So what should we know as regular people about these variants, and should that influence our decisions to get the vaccines? Because do they really work against the variants?
Very, very happy to say that so far, the variants that we know that are of concern, the ones that we know about, so, I'll just run the list. B117, the UK variant, B1351, the South Africa variant, P1 and P2 in Brazil, B1617, that's in India, and a few others. So far, from what we've seen by studies both done in the lab and in the real world, the vaccines are effective against these variants. There's one in particular, the South Africa variant, showed that the level of antibodies that can neutralize or be effective can be lower, but you still get that level of protection. When you look at people who've actually received the vaccine, who are in these areas where the variants are circulating, the protection is still extremely good. So I would not be worried about any of the variants circulating now. What I always say at the end of that statement is there a possibility that at some point down the road, there might be some variant that comes from someplace else or even here that has that ability to escape the vaccine? That's certainly possible. But I personally think that even if that is the case, you'll still have some level of protection with the vaccine that you've received. So if there's a chance we might need a booster shot or an update shot, that's entirely possible. But I think the fact that if you've been vaccinated before, I still think you'll have some level of protection.
And I'll just add, from a very practical sense, we all have enough to worry about now, and we've all had a ton to worry about over the last year and a half and counting. I would ignore any discussion you see from anybody anywhere about variants. The people who need to worry about that are the CDC and their European equivalent, and the folks in India and the folks in Brazil who are surveilling and looking at the samples that are being tested and identified across the globe. And it's a rapid fire. It's actually a modern miracle of human medicine and science, because we are detecting these things so quickly because we're looking for them. And the drug companies have huge investment in making sure that their drug, whatever drug they put out on the market, is effective against all those things. Because the first one that fails and leads to increased hospitalization or death from their vaccine being not successful against a particular variant is going out of business. So there is a lot of compelling reason for people to, in these big companies who have invested billions of dollars and millions and zillions of hours worldwide of time and effort, to make sure that they stay on top of the variants. The other example I'll give you is that the flu shot that hopefully most of you get every year, if not all of us, and if you don't, you should. Even though flu has kind of disappeared from the planet for the moment, it's not gone. And once we're back interacting with each other, the flu will come back. The flu is a little bit different every year, which is why the flu vaccine that we get every year is a little bit different. And so I agree with Tyson that I expect us to be all getting a booster shot based on the predominant variants in our region of the planet, and maybe globally, at the time of year when person-to-person transmission of airborne things like influenza and COVID-19 and the like is highest, which is typically when we're mostly indoors. So that's the colder months in this hemisphere. So that's fall and winter. And when we are therefore interacting face-to-face on a much closer basis than when we're outside, at parks and at basketball games out in the park and whatnot. So I would also agree that I would fully expect us all to be looking to get a one-shot booster of whatever version of the vaccine you've already had, and probably annually. And I'm okay with that, because that means that the scientists are doing their job, keeping track of these variants, so that none of the rest of y'all have to. So don't waste the stress about worrying about what variant might come along. Variants are going to happen. That's how biology works on the planet. The scientists are going to stay on top of it and keep us protected as long as we get our vaccine.
Thank you. So there's a question in the chat that is really important. So it speaks to herd immunity. And we've heard a lot about the percentage of the population that needs to be vaccinated for us to reach herd immunity. And what happens if we don't get there. So I'm going to throw my public health opinion in, and then physicians, please jump in. So I'm just going to speak as a regular person. I don't think we're going to get to herd immunity. The data seems pretty clear that there is a significant contingent of the population, for political and other reasons, who are vaccine hesitant. What's interesting is it is not the populations that scientists predicted would not want to get vaccinated. We as communities of color and science are getting the vaccine, but there are other populations in the country who are not going to get the vaccine. Without their participation, I have serious doubts that we'll ever get to herd immunity. What does that mean for us? It means that we'll need to remain vigilant. It increases the importance of our community being vaccinated and paying attention to the CDC guidelines, because we vaccinate for ourselves and for our community and the people that we care about. We've got no control over other people's behavior. That said, there are, herd immunity is the, I said so herd immunity in regular speak is the percentage of a population, the number of people that have to take the treatment, so in this case, get the vaccine, to provide protection for everybody who doesn't even get the vaccine. So it reduces the likelihood that it spreads as easily as it's been spreading, and the doctors can chime in. I'm not using the medical language like on purpose. And so that's what we're trying to get to, right? So if we could get to herd immunity, then the fluidity of movement and getting things back to normal and things like that would happen a lot faster. With this population that is not going to get, or at least now saying that they're not going to get vaccinated, it makes that less likely. What does that mean? We can still do the things that Dr. Williams was talking about earlier. If we're vaccinated, we can go to the outdoor events and the like. It means that when you're on an airplane, you're still going to need to be wearing your masks and things like that. There are people that are working on those communities. We're not the ones. What we've suggested is, for the same reasons that we heard Gertie and Shelby talking about the success in our communities, it's going to take people from those communities to listen to the concerns of that community, to get trusted voices, to try to convince people to become vaccinated, and then to create ways in which they can register and get vaccinated in ways that work for them, right? That they determine are convenient and efficacious for them. And so the same model that we used for our community, I would argue, is the same model that could be used to try to support an increased uptake of the vaccination. It's just that we are not the right people to do that work.
Amen. Yeah, there's no question. And I agree. My fear, and some of you who have been on that email conversation that we've had, because I'm working with a national organization that's trying to maximize general uptake of vaccination. And we're my question to them and to others was, what's the middle-aged conservative white guy equivalent of the NAACP? Because it is through voices like the NAACP who are of communities of concern and represent those communities that this effort has been successful here in Charlottesville and Albemarle and across the health district here locally. But there isn't one. And so thinking about things like the Lions clubs and the Rotary clubs and to some degree, depending on where you are, the Masons and the Order of the Eastern Stars, more us than white folks, trying to find that platform for these broader conversations to be had, so that the roughly 30%, give or take a few percentage points, of Americans who have declared that they are just not taking it and don't want to hear from Fauci ever because he's lying and think there's bodies buried under the White House. I mean, that we're at that level of resistance. And I will go a little bit more draconian and say, I don't think that's hesitancy. I think it's resistance, right? And so long before COVID vaccine was a thing, there was a giant, well, not a giant, but a significant pocket of Americans who just were they were against vaccines, right? The anti-vax movement, if you will. And there's some Hollywood celebrities and others who have been very prominent in that discussion, or not discussion really. they're not gone, and this is just their most recent cause celeb. But having had a person in the White House who was equally unscientific and equally thoughtless about his approach to this incredibly important public health crisis, they just had fuel poured on that fire. So there's going to be more than enough people that I think herd immunity will escape us, certainly, and that we have that much more reason to make sure that communities of color are in fact fully vaccinated, not one but 2 shots, if that's the path that you have find yourself on, and getting the boosters when the boosters come out, if they do, so that 30% doesn't then kick us a whole new cycle of us getting infected and hospitalized and dying because of their decisions.
All right, so let me get in here because I'm going to take the other side of this. This is my daughter Ruby, by the way. Can you say hi? She doesn't want to say hi. She wants to give you the cold eye.
Hi, Ruby.
But I do think we're going to get there. So first of all, let me just say, I don't think there's going to be this national declaration from the CDC that we've reached herd immunity, take the mask off, do whatever. I don't think that's going to happen. What I do think is that there'll be certain communities that have higher levels of vaccination and will have that measure of protection from herd immunity. And so cases, you'll see they won't rise despite kind of opening up. I have hope that our community is going to achieve that actually. But when you look nationally, what you see is that you have one group that's left that's been hesitant. But we've also seen that opinions can change. And so at the beginning of this, there were a lot of people that were hesitant, including the Black community. And we talked about this ad nauseum. And now the Black community, still a lot of people who have questions, and that's appropriate. But the amount of people who have moved from not ever going to take it, leaning against it, leaning towards taking it or taking it, that has changed. The other thing I need to say is that we are still in the mass vaccination phase of this. We're talking about equity focus, pop-ups and messaging and things like that. But where the vaccine is not right now is in primary care clinics and pediatricians' offices and places where people go where they trust. And so once we get to that phase where there are vaccines available in doctors' offices, where white male conservative Republicans go to talk to their physician that they trust because they saw them for a heart attack or a stroke many, many years ago, that's a much different conversation, a more convincing argument. And I think that the tide in this community is also going to change and more people will go ahead and get vaccinated despite the numbers that we're seeing now. The second reason is that, and this doesn't get talked about too much, but we don't necessarily have to vaccinate the 75 or 85% of people in order to get herd immunity. What that really means is that 75 to 85% of people, or whatever that number is, are protected. And you can get protected either because you've been vaccinated or you can get protected because you've been infected. And so there's a good number of the population who's already been infected who do have some level of protection. That protection is always better if you get vaccinated, of course. So we do advise people who've had COVID to get vaccinated. But I do think that's going to increase that effective number of people who have protection, even in these communities that are resistant to get the vaccine. And so I do think that will eventually make it. It may be longer than we all hope, but I think it'll be very regionalized and localized. I think we'll be able to get to that level here. But I also think that more people are going to eventually get vaccinated.
I love the positiveness. Yay. That makes me feel better. Let me ask a question because so is it possible to have then what we would typically call as herd immunity regionally? Is that what I hear you saying? And so if you reside in an area where people are, we have college students coming in and out, so that sort of throws a monkey wrench into it. But is it possible to get regional herd immunity?
Right. This is all a very regional concept. So we have people who come in from, don't wipe your nose on my shirt, please. We have people who come in from out of town and out of state and things like that. So there's always that possibility that something get introduced, that's always there. But if a community achieves a high level of vaccination, and for the most part, people are interacting with each other, it's not like we all travel every single day. we will have, at least regionally, a measure of herd immunity. So, what's going on here in Central Virginia is going to be very different than what's going on in Spokane, Washington, or, Amarillo, Texas. And so if they're not vaccinated and they're not protected and they're doing mask off and all this sort of stuff, there might be someone who travels into here or whatever, but if we're vaccinated and we're protected, we have that measure of safety. And so even if, there are areas of the country that haven't achieved it, if we protect ourselves, we're good. And that's why it's so important that, we need to take care of ourselves. Like my grandmother said, why worry about someone else's home if you're not taking care of your own home? So take care of your house, get yourself protected, get vaccinated, and let these other fools do what they want to do what they want to do.
Yeah, no, I agree. I will say the question really comes down to how do you define the herd, right? If the herd is Americans, then I don't agree with Tyson. I think we're going to fail to get all Americans protected in that sort of macro epidemiologic concept of herd immunity. I totally agree that here locally in Charlottesville, Albemarle, we are already way ahead of most of the rest of the Commonwealth of Virginia. And I think there's really good evidence that the outbreaks that took place in Northern Virginia did not make their way to us 6-7 months ago. So that, there was a clear hyper-local effect in Nova that we didn't see and have not, knock on whatever that is, have not yet seen here in Charlottesville, Albemarle. But that is why I don't think we can say that we're going to have capital H herd immunity for the whole country, because I think there are unfortunately, I think a high number of folks who just, for whatever reason, and I've had enough conversations with colleagues around the country that I agree with Tyson that I think once we get to the point where a vaccine, and this is the other reason why J&J is so important to all communities. J&J is much easier to hang on to if you're a doctor's office or a clinic. It doesn't have to be super crazy cold like the Pfizer does, or even really cold like Moderna does. It can just be kind of fridge cold, basically. And that's a lot easier for practice to maintain a supply of vaccine and then give out as demand dictates, compared to the stuff that's got to be kept super duper cold. And one of the reasons that UVA got vaccine earliest is because we had a couple of those really cold freezers, and nobody else in the region did. It wasn't because we were any special place. It's because we had the infrastructure of these freezers. So I want to be wrong. This is one of those times when a surgeon wants to be wrong. I want to be wrong. I want the herd immunity tipping point to be as soon as possible. But I fear that we will probably never see the end of regional trackers of COVID numbers and sort of being thoughtful about where one goes for travel, whether it's vacation or business or whatever, about what the local numbers are, because it isn't 100% protective for any one of these vaccines to prevent infection. Much closer to that for preventing serious infection, hospitalization, and death. But it doesn't mean that people, and we're beginning to see these cases pop up right and left of people who are fully vaccinated who still get COVID infection. The good news is, I think I'm only aware, Tyson, you probably have better data on this than I do, of one person who was fully protected in terms of the antibody response and the time lag from last dose, who had died of COVID infection, and I'm only aware of one, I think. So it's still incredibly effective, and that's the way to keep ourselves safe, is to maximize uptake amongst our community here locally, both Black and brown folks, but also everybody else who are not in that group of us, so that even just the amount of virus that's in the community drops precipitously. And that's the other part of human immunity, is that the number of viral particles goes down, because the viral load in Janita and Mike and Tyson and Greg, et cetera, is individually lower than anybody else if we do get infected. And so our chances of giving it to somebody else is that much lower. And I got to run. My crew is.
Thank you. Yeah, thanks for coming. Thanks.
My pleasure. Thank you all so much, and stay safe.
Yes, thank you. I see that Reverend Brown Grooms has her hand up.
Speaking of regional immunity, won't that require policing of different regions? You've got to be vaccinated, or somebody's got to know that you're vaccinated before you can become come into a region where the immunity is in effect? It's just a social question.
Yeah, I don't see that sort of thing happening here in this country for a couple of reasons. You know, something like that would have to be mandated by either a local district, a state government, or a national government. And there's absolutely no appetite to impose anything like this. Or the government has said, we're not even going to track, you know, passports or digital passports or that sort of thing. And I don't think there's going to be much appetite for that on a local level. I think what could happen, and I would anticipate, are that businesses and other establishments might, in the interest of public health, put in requirements that someone either prove that their test is negative recently in the last couple of days or something, or they've been vaccinated in order to go into that place of business as a way to ensure their customers and patrons that they're going to a low risk environment. They are within their right to do that. And a couple of companies have started to require things like this. So I could anticipate like airlines, maybe like, you know, and other concert venues, things like that, having that sort of requirement. But I don't see you know, you can't enter Lynchburg unless you've been vaccinated because, you know, there's a level of immunity here. I just don't see that happening.
Thank you. Are we likely to become another India?
No, I don't think that's going to happen here. I think India is suffering from a combination of a very, very densely populated population, 1 billion people, and, you know, a fraction of the size of the United States. I also think that the fact that they have not have a good portion of their people vaccinated beforehand is what led to this explosion. So, and their healthcare infrastructure is much less developed in here in the United States. And so, you know, we have, you know, we certainly had our issues when we had our surge with like PPE and things like that, but we were not running out of, you know, for the most part, we weren't running out of oxygen and like that sort of thing. We talked about ventilators, but that really didn't become, you know, too big of a problem. But I think in India, there's this perfect storm of a lot of people packed in tightly without protection. And, you know, that just kind of exploded, but I do not see that happening here.
Thank you.
Well, we've got time for one more question. If anybody has one, you can raise your hand or put it in the chat. As I noted at the beginning of this time, I want to thank our panelists for joining us. And the recording of this will be available soon. And we'll post it on the Your Life Matters website so that people can view this again and share widely with friends. I also remind everybody that there's a vaccine event next week at Mount Zion. And so please check into the Your Life Matters website for information about that event so that you can get signed up either by phone or by paper or by the internet. The URL is in the chat. So if you want to copy that, thank you, Diana, for putting it in there. So if you want to do that online, we want to thank everyone who came. And remember that, you know, this is my takeaway. You know, we don't vaccinate just for ourselves. We vaccinate for the people that we love and the communities that we care about. So your life matters. And that's why we hosted this. And thank you for all that you do. And hopefully we'll see you soon. If you have other questions, please feel free to reach out to us. Thank you very much, everybody, for your time, and have a good evening.
Thank you.
Thanks, everyone.
Good evening.
Thank you.